Good afternoon and happy Tuesday. Today is February 22nd, 2022. It's one of those fun days that we get to talk about twos. My name is Dr. Tanya Smith Bryce. I am Vice President of Education for the Council on Social Work Education. And I want to thank each of you for joining us this afternoon in our workshop entitled Exploring a Culture of Fairness, Respect, and Anti-Racism in Health Professions Education. Language matters. The goal of this workshop is to explore the importance of language for setting up action on improving diversity, equity, and inclusion, and eliminating racist structures in health professions education. The Planning Committee began meeting during the summer of 2021 with the task of developing strategies to eliminate racism, specifically anti-Black racism, in health professions education. We identified 3 potential levers of change: creating safe spaces to cultivate an anti-racist environment, accreditation, and the ways to measure through metrics. We have had a workshop on creating safe spaces, and just last week or so had an amazing workshop on accreditation and the impact that having anti-racism as a language, as a word documented in our accreditation standards, the value that that has and the way that that can move us forward. This session today will focus on language. It matters what language we use as we do this work. So I'm going to turn this over to my vice chair, Dr. Rick Baker, who will share with us the foundational language used to advance this important work. Rick?
Thank you, Dr. Bryce. Given the broad scope of this challenging topic and the fact that our audience is at different levels of knowledge and understanding, I'd like to present 5 foundational points. These points are admittedly aspirational, but hopefully will be useful in facilitating a common understanding of the topic at hand and also a more focused and intentional discussion. First, I'd like to make a clear distinction between DEI efforts and anti-racism efforts. DEI is extremely important, but the focus of our planning committee and its activities is anti-racism. DEI enhancement may be a pathway to or a platform for anti-racism. However, progress related to DEI should not be substituted or conflated with the achievement of goals related to anti-racism. Secondly, I'd like to point out that race is not a biological construct, it is a social construct. Race as a biological construct is a pervasive and strongly held but inaccurate belief and assumption. Science has definitively demonstrated that race is not based upon meaningful biology. It is at best a poor and often misleading proxy for real biological determinants of health, such as ancestry or genetic predisposition. This misrepresentation, particularly among our faculty and students, is highly problematic and is the basis for perpetuating false beliefs, misinformation, inappropriate curriculum, and inappropriate care. As my third foundational point, it should be emphasized that health inequities experienced by specific marginalized race ethnicity groups are primarily the product and the consequences of racism and not race. Race is a powerful social determinant of health. Despite the undeniably powerful impact of racism on health, historically the term racism has been typically de-emphasized, ignored, or actively avoided in discussions related to health. My fourth foundational point is that it's useful to distinguish between structural or institutional racism versus interpersonal racism. Discussions, activities, and proposed interventions germane to anti-racism efforts in the health education environment primarily focuses on structural or institutional racism as opposed to interpersonal racism carried out at the level of the individual. As articulated by authors in our pre-readings, structural racism is a direct derivative of the institution of slavery. It is defined as, quote, the totality of ways in which societies foster racial discrimination through mutually reinforcing systems of housing, education, employment, earnings, benefits, credit, media, healthcare, and criminal justice, unquote. This includes the processes of racism that are embedded in local laws, state laws, and federal laws, embedded in policies, and embedded in practices of society and its institutions that provide advantages to racial groups deemed as superior, while differentially disadvantaging racial groups viewed as inferior. My fifth and final point sets the stage for the ensuing discussion. We know that structural racism is deeply embedded in all of our society and that it broadly involves numerous actors across multiple institutional platforms. Given the reality that structural racism extends far beyond the educational environment, today's overarching questions are twofold. What is the role and challenges of deans and other leaders in creating anti-racist organizations in the HPE arena? And secondly, what is the roles of deans and other leaders, again, in the context of language, in mitigating structural racism's pervasive and damaging effects on students, faculty, and the patients we serve? Hopefully, providing these 5 foundational points gives us somewhat of a common understanding and awareness going forward. At this point, I'd like to hand over the program to my esteemed colleague and co-committee member, Dr. Sherilyn Black, who's Associate Vice Provost for Faculty Advancement at Duke University. Dr. Black, take it away.
Thank you, Rick. As Rick said, I'm Sherilyn Black. I'm faculty in the School of Medicine at Duke, and I serve as Associate Vice Provost at the university. And it is my great pleasure, given those roles, to introduce our main speaker for today, Dr. Mary Klopman. Mary is the Dean of the Duke University School of Medicine. She assumed that role in July of 2017, and she is also former chair of the Department of Medicine in the School of Medicine. I was told to direct you to the agenda online to see her full illustrative biography, but what we really want to get into today is her discussion. Tanya mentioned earlier the importance of language, and I have been able to witness firsthand the way that Mary has had to expertly communicate, sort of engender support and rally the troops to put together a very comprehensive plan around diversity, equity, and inclusion for the School of Medicine and beyond. So Mary will speak to you first, and then she and I will have a facilitated dialogue afterwards. So please feel free to put any questions in the chat. Mary, I'll turn it over to you.
So thank you, Sherilyn. And I must start by saying it's with a great deal of humility I come and talk to you about this topic, all of you. And I expect to learn much more from you than you're going to learn from me. But I welcome the opportunity to share my experience. I'm going to do a brief PowerPoint just to kind of walk you through what we have been thinking about and doing in the School of Medicine at Duke. But again, really look forward to a much more open conversation. So if I try to think back, spring 2020, it's really difficult actually for many, many reasons because so much of our lives have been upended. But if you asked me about the work that we were doing in the School of Medicine, it was really around diversity, equity, and inclusion and not anti-racism. And I was pretty comfortable with the fact that we had values that I could be proud of as a school. And for several years, we had engaged our chairs in various opportunities to improve their institutes, their centers, their departments, in fact, even had an incentive plan. But all of us know then what the spring of 2020 was like. And, you know, in the real early part of the pandemic and realizing the tremendous disparities that showed up very early, and then just the horrible experiences we saw play out with the murder of George Floyd, and I could go on and on. That was, you know, I think a shock to many of us to see it all in front of us in ways that we hadn't seen before. And what really engaged me was hearing from my own community. And I can remember the evening that the SNMA group of underrepresented students wanted to engage with me. And it was heartbreaking, frankly, to hear their personal stories about how their experience at Duke were so different than what I thought. And these were students that I thought I knew, and I was, very proud, and they were very engaged with me. But at this moment, they were willing to really open the conversation up and go in a direction that we had not gone in. And soon after that, I received a letter from Black faculty, many of which were my colleagues in the Department of Medicine, people that I grew up with. I trained at Duke, people that I worked side by side with. And again, hearing how different their experiences were than what I appreciated as their leader. And that to me was heartbreaking. So what we did in June 2020, rather than having our annual state of the school where we discuss how, the wonderful achievements, really focused it on what we were calling at Duke University writ large, our moment into movement activities, dismantling racism in the university, in the School of Medicine and beyond. And this was a pivotal event for the school because it really engaged our community in very painful conversations with testimonials from, again, faculty that we knew and worked side by side with. But it started us on a really important strategic planning process. Now, I was not doing this in a vacuum. Vince Price leading the campus side of our institution and Gene Washington leading the health system side of our institution were engaged in similar conversations and engaged all the leaders across our many departments and schools. And in fact, Duke Health came out with a very detailed anti-racism pledge that now sits in all of our rooms. But this is not about words. This is about change. And so the way that we really do things in our School of Medicine is when we really want to take on something, we do a strategic planning process. We take it on in a very intense way with a period of self-study, a period of engagement, and then coming up with a plan. And that's what we did in most of 2020 and going into 2021. This is just an organizational chart to show how we organized ourselves as a fairly large school in the university. Obviously, I set the charge. I met regularly with constituent committees, and I'll tell you about the committees we formed, but I did not put myself in the middle of this. In fact, I stepped aside to give our leadership and committees a lot of room to plan both the process of planning and come up with their recommendations to me. Many points through the year, my committee leads would say, don't rush us, don't push us. This is hard work. It's not certainly work where we find solutions overnight. I did have an oversight committee that were the leaders of these 4 planning committees and a few of my chairs and institutes to check in with our progress over the year. So we organized ourselves around 4 communities. One is our health professions students, another is our grad student and postdoc committee, a faculty committee, and a staff committee. And I want to say that this is the first time, and this is not easy for me to say, the first time we ever focused on our staff in a really purposeful, focused engagement, and hopefully certainly will not be the last time. So these 4 committees, they created their own working groups, and they each did it a little bit differently. But overall, the course of a process that took about 9 months probably engaged 500 plus members of our community within the School of Medicine. They produced for me, each committee, 60, 70 pages of self-assessment, observations, recommendations, and we took that all and really merged it into a roadmap for the School of Medicine. And as you can imagine, many of the themes were very similar across the 4 groups, but some of the tactics and details are quite different. But we came up with some of our overarching goals, and I think these are goals that we would all agree on. But we did expand our focus beyond diversity, equity, and inclusion, and specifically address the goal of being an anti-racist institution. And for that, for me, that meant looking at really structural racism. What are our processes, policies that have perpetuated who we are without change, despite the values that we all professed to be focused on? So as I mentioned, that did produce a overarching framework with priorities that go across all of the communities. One is certainly about our culture. Another is certainly about how we nurture and attract outstanding talent at every level, how we advance the education and training to support an anti-racist workforce. This is not only how we look at our curriculum of all our health profession students and our graduate students, but how we train and educate ourselves, whether you're the dean of the School of Medicine or your new entry-level employee. One area that we have had quite a bit of work on, but always room for improvement, was engaging our research enterprise in really working with the community around research practices. And that work is largely led by Ebony Boulware, who's head of our CTSA. And then really a focus on leadership. And that means me, and that means my chairs and my centers and institute directors, and how we really add a dimension to leadership that is embedded in our searches, embedded in how we're evaluated, embedded in how we hold ourselves accountable. We identified a number of enablers that we need to strengthen to make this work really happen. Certainly our structure, our data and transparency, our partnerships outside the school, communications, resource allocation, I'll talk a little bit about certainly, and how we also engage our alumni. So the organizational structure, the first decision was to have a new position in the School of Medicine, and that we've done. We created the Vice Dean for DEI work, and we have a new Vice Dean, Kevin Thomas, who after a national search became the top candidate and started about 2 months ago. But this work, everybody has to own. It starts with me. I am accountable for the work, but so are my vice deans. So are my chairs. So are my institute directors. And the boxes I have underlined here are individuals that are being held accountable in everything that we do. They are my leaders at the next levels down. They are being held accountable in terms of incentives. We are really much more focused on how we incent progress in the work that we're doing. They're being held accountable by their own departments, and they're being held accountable by the other parts of our institution. So the recommendations, I mean, the framework is 60 pages long. I would gladly share it with all of you. I have read it many times. It is broad and deep. And this work is going to take us years, and we will probably never finish all the work that we need to do. But I wanted to use one aspect of it to give you a sense of how we move from this planning process to real action and change. So in the time period in which we were putting all the recommendations together and doing the search for the Vice Dean, a lot of my leaders, I encourage them to read the documents that were produced by each committee and start thinking about how do you take those recommendations, and whether you're Dean of Med Ed or you're head of our APT committee, how you can start moving the ideas forward. So the head of my clinical APT committee did just that. And he has led a tremendous amount of work in a very short period of time. First of all, he extracted all the recommendations and frankly, a lot of the data, which I won't go forward, that started to inform the work that he was going to do with our APT leaders in all of our entities. Certainly recommendation to require anti-bias, anti-racism training across all of our leaders, increase the BIPOC representation in leadership by 100% in 5 years, increase Black faculty at full professor level, 100% in 5 years. I mean, they got down to real detailed recommendations, build an IT structure to support the APT process so we could really follow, how we are doing, acknowledge the full breadth of scholarship that Duke values, including work in DEI, and completely revised departmental APT committees. And I'll go through some of those details, and then transform the annual review process of our faculty. So those were the recommendations that my APT leader picked out. And then he started to really work on what does that mean to what I call rewiring our institution. And so some of the 18-month priorities for the APT work was revising the annual review process, recommendation that our DEI leads in each department are engaged in the review, particularly of BIPOC faculty, revising the template to recognize DEI activities. We have a pretty standard template for annual reviews, but really calling out DEI work as part of our review, creating standard guidelines. We heard repeatedly they're variable, they're not transparent. Committee composition was really variable. And so we are coming out with really very specific guidelines, what committee diversity looks like. Committees members must have experience in DEI, obviously implicit bias and anti-racism education, an annual review of faculty progression data by race, ethnicity, gender, to really serve as a report card to us on how we're doing. Also, really systematizing the APT expectations, enhancing communications, because we heard repeatedly, we don't even know what our processes are, broadening the definition of scholarship. And this group created a wonderful document about how we define scholarly work in this area. What are the metrics that we use so that all of our APT committees can really start introducing that into their local review of faculty. And then develop an information system that constantly gives us feedback. So the document that Jimmy Chang and his colleagues produced in the APT work was a framework for what we call JEDI, Framework for Scholarship in Justice, Equity, Diversity, Anti-Racism, and Inclusion. And this covered everything from research to service to education to clinical domains. And this is now a living document where faculty can actually read and understand how they can incorporate work into their scholarly review in a very meaningful way that will be part of their profile at Duke. So I use that just as an example, but I can give you that example across many of the domains. As I said, it is broad, it is deep, it's going to take a tremendous amount of time, effort, but we are starting. And I think a lot of the work that we're looking to take on is similar to some of the work that you all in your institutions are really trying to take on. I'm not going to go too much into some of the actual specific sort of, I think, principles that push us, but to just recognize that we need to hold everybody accountable for this work. It's not just the dean, it starts at the top. In terms of my personal growth, I have been very fortunate to participate in some incredible education opportunities for me as a leader. Started with a Teach Equity course that Judy Seidenstein and her colleagues have put together at Duke. Just a remarkably intense personal investment and learning, but working with Jean Washington and the health system, also part of a foundational leadership development course. So it starts at the personal level and goes beyond that. And with that, I'd love to open it up for questions, share my learning, and certainly learn from you.
Thank you so much, Mary. That was an excellent overview. And I think it was a really great launch pad to have a discussion with you about this. I have lots of questions, and I'm sure that this has probably sparked a lot of interest in the audience. So please feel free to send me any questions you have. I'll try to be comprehensive with what I've got. So Mary, the first thing that I would say is I remember when I heard your strategy of you as the dean sort of stepping back and allowing others to really take the lead. I remember thinking that was a fascinating strategy, because a lot of times, as you know, a lot of this work is really sort of pushed by the sort of senior local leader. Can you talk a little bit about how you sort of knew that that was the right step to take and how it was received by your faculty and by the staff and the students.
Well, a couple of things. First of all, I didn't have the answers. I mean, a lot of times as a leader, you kind of pride yourself in having some idea of how we solve problems. And I knew that I did not have the depth and breadth of knowledge to really lead this strategy. But I also knew that I had members of my community, either through their own work or their own personal experience, had tremendous amount to bring to the table. And so I needed to turn it over to them because they had expertise, but also because we really wanted to engage. And sometimes when you're the senior leader, people are not as comfortable speaking their mind. Although I must say, I was very pleased at the beginning of this work that our students were the first to come forward and be open with me. But I think stepping back allowed other members of our community to be able to be very candid. And I think that's what happened. I didn't zoom in on every conversation. And in fact, the committee leaders were very specific about when they wanted me there and when they did not. And I think that allowed for conversations that needed to happen.
Yeah, I would agree with that. I would also say a lot of the information that I heard from the provost side of things was that it really indicated the trust that your constituents had in you, because, and vice versa, they felt trusted and respected by you in this process. And I think that that really helped everyone to engage in a way that really allowed you to get rich content.
Cheryl, I want to say, I probably should mention, I did something else that I've never done. I recognize that this work is so hard and so taxing. I actually paid our leaders and paid our students. Now, that is not something we do naturally. And we had lots of conversations about that. But it sent the signal to people that I recognized how hard this work was.
Yes.
And particularly to individuals that had been asked over and over again to work in this space. And, you know, it didn't make anybody rich, but I think it went a long way to say, we know it is different. We know that it often falls on a small number of faculty shoulders to lead this. And I can say the steering committee leaders wanted to do this work, not because I was paying them, but it said something.
No, I mean, that's critically important. It also validated their expertise in this area, as we would with any other expert of any other topic where we want to bring rigor and scholarship and focus. So I think that's an excellent point. And I think you're also, alluding to something else I was curious about that you mentioned, which was thinking about how you're attributing resources in this space. So that's one example that you as a leader made what I think is a very smart decision to compensate faculty that were involved in this work, or any leaders involved in the work. But obviously we're in a pandemic, and a lot of institutions who are interested in this work are saying, I have all these ideas, but I'm bumping up against these walls. How did you balance the many competing demands with finances, with also understanding that this was a priority that needed to be accomplished in a sensitive amount of time?
Yeah, as a dean, you're asked every day for resources. Sometimes, several $1 million a day. And it's kind of, one of the just unmanageable parts of being a dean. But I approached it a couple of ways. First of all, if it was just about new resources, that's not going to be sustainable. So I made it very clear to, all of my leaders that it's not about new resources unless we start by changing how we use our current resources, particularly around things like faculty recruit. We really need to change how we recruit faculty, not just the dean's going to come in with new money and therefore we can add on different faculty. So I made it clear that there would be no new resources in certain things unless I saw change in how my search committees were identifying faculty, the candidate pools they were bringing forward. Because I really worried that if it was just about, maybe the dean has more money and therefore we'll find a few faculty members, that's not a sustainable change. But then I did prioritize this work in terms of my resources. And it took the top priority this year for any new resources. And I did have an opportunity. Our university investment pool did very well last year. And I said, great, this is what I'm doing with those new resources. And those resources are really going to building the infrastructure, the data analytics, the reporting platforms that we need to do to allow my departments and institutes and centers to change. So I did bring new resources, but I was very careful to signal to my leaders, it shouldn't just be about new resources. It should be about how we spend all our precious resources. And then, of course, as you know, and as you're leading, we are going after the first award and looking for external. But again, I just think, you know, we're lucky. We are a rich institution in many ways, and we need to use those resources differently. And I'm starting to see that, which is great.
Yeah, no, absolutely. I think that that's key. And I'm curious about, as you said, you know, you sort of had to transparently communicate this to your leaders, many of whom might have had other ideas for how those resources should be allocated. How did you go about putting together a communication plan where you would be able to sort of share your priorities while also still, you know, sort of not disenfranchising some of the people who feel that they have other needs at this time?
Yeah, well, I think it started with that state of the school. I think that caught everybody. I mean, it wasn't because I was so eloquent. You know, we really had faculty that spoke from their heart, and I can't tell you how many leaders said to me, "Oh my, you know, I didn't know, I didn't know." And then we have, after we got our framework, our roadmap completed, I've gone out to all our leadership groups to engage them at the high level of, you know, our goals and our strategies. We now have a much more detailed communication plan on a regular basis. We're going back and reporting out, and then building in real incentives that align what our leaders are doing locally with the priorities of the school. This is a priority of the school. I have been absolutely clear about that. And leaders start to know what that means. It means, oh, resources are going to be aligned, incentives are going to be aligned. And you know, I didn't have to convince many of our leaders that this was really important. That's the good news.
No, I think that that's very clear. It seemed, from the outside looking in, it really seemed like you had a very comprehensive team that was ready, sort of in a unified lockstep fashion, to move this forward. And I think that that was a big part of what helped the community to feel confidence that this was actually going to result in true change.
Yeah.
I know we have a few questions from the audience. One question I did want to ask you quickly that was related to your previous question is, you know, in this communication, I know that you must have received some pushback. Can you just talk a little bit about the nature of the pushback and how you handled it?
You know, it's interesting. To be honest, I haven't gotten that much pushback. And maybe it's because I have been so upfront about and clear about the priorities of our school. And, you know, is that a good or bad thing? Or are people feeling uncomfortable not to push back? Now, I do see it on survey, you know, on the free text and surveys. And I would always encourage everybody to read the free text more than the data, because it tells you a lot more. And I know that there are members of our community and our faculty that would not agree that this is a priority, or would more likely say, well, we're doing fine, or we're doing all I can, or we can, leave good enough alone. You know, and I think our role is to really create a education platform that brings our leadership along. I have personally invested my time, and it you know, I'm drinking from a fire hose, frankly, in terms of my learning curve. We plan to do that, you know, at many levels of leadership in the institution. So we're all learning as we go. So I've been surprised that I haven't gotten pushback. But, you know, it's still pretty early, and we'll see when, you know, when you set priorities, it means other things aren't going to be done.
Yeah.
And so that's when I suspect I'll start feeling some of the pushback from my leadership.
Yeah. Yeah. And I mean, and, you know, I think a big part of it also is, as the time goes on, there will be some level of fatigue. We've seen this a lot when you talk about diversity and equity work, but it sounds like the way that you're structuring your communication strategy, hopefully it will mitigate some of that pushback that could potentially come. I see you've got a couple of requests for the report. Like Mary mentioned, I think we'll make sure that we get that disseminated to everyone who's here.
Yeah.
You have an interesting question here that's talking about all of the committees and really wondering, how did you decide who was going to be on all of these committees? So you've got the staff committee, you talked about the health professional, education committee, you had the staff committee. Can you talk a little bit about that selection process?
Yeah, the only selection I did was the leadership of the committees. And I worked with, at the time, I didn't have the vice dean, but as you know, I had Judy Seidenstein, my chief diversity officer, who knew a lot of our leaders in this area of work very well. We've had a council for a number of years. And so we worked together to come up with the committee leaders, but they chose their who they wanted on their committees. They chose who they wanted to engage. I did not get involved beyond that. And just based on the quality of work, I think the leaders we chose wisely. They were just extraordinary. But I think even more important were the next level down leaders and members that they chose to engage. And a lot of them were not the usual suspects.
Mm-hmm.
And I have had particularly faculty that participated, for instance, in the faculty committee that had never participated in anything so intense,
Mm-hmm.
and gave me a lot of feedback like, wow, I am so glad they chose me.
Mm-hmm.
And these were not people that had been engaged in this work. So I think the committee leadership, just they were brilliant in how they engaged and who they engaged.
Mm-hmm. Yeah, I think that, the structure and they're just having such a broad group of individuals involved really did make this feel like it was a full community, all hands on deck effort. And, one person that's in the audience has an interesting question here. And they're saying, the School of Medicine obviously had previous efforts in diversity, equity, and inclusion. So what's making this one different? Why do you feel more confident in this one? And what do you think was missing in the previous efforts compared to now?
That's a question I've thought a lot about, because as I said, last 2020 spring, early spring, I would have thought we were really focused and leading in this area. And I think the difference is at a couple of levels. Certainly one, the emotional engagement. I must say that, as a scientist and a dean, I'm always like listening and listening for to problems and coming up with solutions all the time. And I'm, my knee-jerk reaction is, okay, we can solve this. Being confronted with something as challenging as this kind of threw me off quite a bit. So I engaged emotionally at a level that I don't think I've ever engaged before. In fact, I remember my husband is dean at Baylor, and he came one weekend, Friday evening, and I was in tears. I mean, I was just in tears. And, we talked about it, and it was really the night after the students. I mean, these are students that I was very close to. When they had shared with me their experience, it was heartbreaking. And, as a mom, I just felt like I had let down my children. And so it's that level of my own engagement, which was really, really important. And then I think the other thing for me is realizing that we have to rewire our whole processes and policies.
Mm-hmm.
That some of the lack of change was because we didn't change how we do things.
Mm-hmm.
You can't change having, so few underrepresented full professors unless you change your APT process.
Mm-hmm.
And so I think the realization that we had to get down into the weeds on policies and processes, even ones that come up against the university, Sherilyn, which we will be doing, to make a difference.
Yeah.
You can't have a distinguished professor process that has no underrepresented distinguished professors.
I would agree with you.
So I think that realization that it's not just, implicit bias training and stating your values, it's being willing to change at the fundamental level. And I call it rewiring. And that's, to me, the sustainability of change.
Mm-hmm. Yeah. And I mean, I think that as scientists, we know that we have to do hypothesis driven and evidence driven methodology to get changes, right? We can't just sort of guess and sort of, apply an idea and then be surprised that it doesn't work, or keep doing the same thing over and over again, to your point. I think that's a really important thing that's come out of a lot of this work over the last 2 years, is there are fundamental shifts that have to occur to make progress in this area.
Yeah.
You just talked about the deep emotional investment that you've taken. And you did touch a bit during your presentation to talk about some of the sort of education that you did yourself. What I'm curious about is sort of what kind of education did you do to try to prepare yourself for this process as a leader, especially with all the anti-Black racism that was going on? And how did you think about education for the school in addition to the overall process, but really thinking about getting everyone level set in that way?
Yeah, so education is a very large body of work that we are doing. We are certainly not there yet. I had some leadership training and certainly worked with Jean Washington as chancellor and some of the training of the senior leaderships in the health system, which I'm the vice chancellor. So I had some groundwork, but I did participate very early on in Teach Equity. And I don't know if you know that, of course, but that's an extraordinarily intense experience. And that I did fairly early on, and set for me a whole different level of understanding, particularly around language, which I hadn't really focused on before. The next step in educating our leaders is now I am requiring every one of my chairs, centers, and institute directors to participate in an equally intense education platform. We have Judy Seidenstein and Kevin and their team have looked at a couple of options. We're going to give some flexibility, but every leader must commit to the time and engagement in one of the really high quality training programs. We are going to be working with campus and working with the health system on different education platforms. I mean, we're a huge institution, as you know. I think we have 30,000 employees in the health system in the school. Different education platforms that will be somewhat tailored to the communities that we're reaching. Establishing, some common language and common understandings, but then very tailored. If you're in medical education, we are looking at a different training and education option than if you are in our research leadership. So we're starting to develop opportunities, but it's a huge undertaking because we are big, we're diverse, we have lots of agendas. And so I think we have a lot of work still to do there.
Yeah, I think, and I know education has really become a central point for so much of this work, like you said, around language, around lived experiences. That leads me to another question. I've heard this one a lot, at a number of institutions nationally, which is, and you also alluded to this during your talk, that these plans have so many recommendations. It's going to take years to effectively accomplish them in a way that leads to systemic change. How do you balance that longitudinal effort with the short term for the people who are actively having a hard time right now, who are experiencing racism and microaggressions and other isms that are making it challenging for them to complete their work, feel valued? I know that you've got some short-term goals and some long-term goals. Can you talk a little bit about how you did that balance and how you're making sure the people most impacted by racism are actually feeling the improvements?
Yeah, no, there's a real sense of urgency. And I think a need to show tangible changes. And so we're trying to pick things early on that we know we can do, that sends the message, but not be unrealistic. We don't want to set a whole bunch of goals that we don't meet. So really being very thoughtful about those short-term goals. Very visible was the creation of a new vice dean role. That sent a very strong message because people know that's resources. They know that a vice dean is a very senior leader in the School of Medicine. So starting with some of those wins that signal our intention. I'm now going through kind of the next round of goals and where we build them in, and being thoughtful about targets for, let's say, recruiting faculty, that you can disappoint pretty easily.
Mhm.
And so we're really trying to be very thoughtful of how we do that and what goals we set. As I said, the report came back to me, 100, increase the number of underrepresented full professors by 100%. Now, didn't give me a timeline. And so we're really kind of playing that out as to how we can do that over what time frame, because the worst thing is to set a bunch of goals and not meet any of them. So, it takes a lot of thought in terms of how you prioritize, but some early wins, you have to have them.
Yeah, I mean, those are critical also to keep people engaged. I see we've had a couple of questions from the audience asking about, how are you keeping so many people engaged, especially with so many different sort of subcultures and experiences throughout such a large school.
Yeah.
I have a couple more questions for you. I'm watching the time here. One of them I'm really curious about is, given that the School of Medicine is so large, and I know a lot of people that are on this call can relate to this, how do you make sure you're not working in an intellectual silo? I think this happens a lot with diversity and equity work, is that people get so myopically focused on what's right in front of them that they lose perspective of the larger institution and some of the other efforts. How are you making sure that you're keeping crosstalk and bidirectional work in that way?
Yeah, no, that is a great question. And particularly when you're in dean's office, you can be siloed pretty fast during COVID in particular. I think survey data can be very helpful to give you feedback that's different from the normal talking heads that you're generally surrounded by. And, I think survey tools become very important. As we had the first really broad survey around our work in this area just this year that included staff.
Yes.
I think that becomes a very important instrument to really test whether we're in an echo chamber or we're reaching our staff, we're reaching our faculty. So I think we have to use those tools, because otherwise it really is impossible. The other, I think, strategy is getting deeper and deeper into your organization with this work. So it's one thing to have my chairs and institutes and centers, but we're really starting to map out, different levels of engagement that starts to get down to the individuals that are staff members in different parts of our organization, or that are students in some of our programs that we generally don't hear from. So, I think we need a couple of strategies, but survey information, I'm sure you've started to go through it. It is rich with feedback. And we need to use it.
Yes. Yeah. And I think, one of the things you're saying that's key is about elevating the voices that are normally not heard. If we know that if we're talking about truly being anti-racist, and we know the largest aggregate of individuals at the institution are staff members, it's really important to hear those voices. And I think you're right. That's a really important point that we've had now that we can start to move forward from.
Yeah.
I've got two more questions for you.
Okay.
One of them, which I think is a lot of people are wondering, what is success going to look like for you in this process? It's such a huge process. So what does success look like?
So, there are things that we want to measure, and we need to measure. So some of the things that we're talking about it's certainly numbers, and numbers are really important. We don't have a full sort of representation among our highest levels of our faculty, highest levels of accomplishment, like distinguished professorship. So we certainly have those goals. Improvement in our survey data is going to be success, going in a positive direction, particularly among parts of our community that are not have not been very engaged in the past. So using that to measure progress. Ultimately success, which is going to be way after I retire, is when we've gotten that hardwiring done so much that things happen naturally.
Yeah,
And,
absolutely.
But that's years away.
Seeing that longitudinal work is going to be key. I'm being told to wrap up. So the last question I was going to ask you, which maybe you could add in the chat, is if you have one piece of advice you would like to give to all the other deans that are on this call listening, just the top thing that's come to you over the last 2 years of this work. Mary, thank you so much for taking the time to talk to us and share your experience. And now I will turn it over.
Thank you for inviting me.
Yes, thank you so much. I will turn it over to my committee member, Lenny.
Hello. Well, that was a very interesting conversation, Mary and Sherilyn, and we'll move to the next conversation with an esteemed group of leaders to address moving the needle to improve DEI and promoting anti-racism structures. And we'll have you please look at the agenda to see the bios of each of the panelists. And we will begin with Dr. Thomas Leveist, who's the Dean and Weatherhead Presidential Chair in Health Equity, to share with us some information that kind of frames this discussion. And then we'll have each of the discussants talk with us. And so please, I'd like for us to move on to Thomas sharing a framework for us.
Sorry, but my video has been stopped by the host. I'm not able to turn my video on.
Apologies, you should be able to do it in just a second. You're all set. Thank you.
Okay.
Great. Good.
Thank you very much. I appreciated that previous presentation, and I look forward to reviewing the Duke program as well and see what we might incorporate here at Tulane. So, when George Floyd was murdered, this led to a new reckoning, a new recognition of what many of us had recognized for many years, which is that there are entrenched inequities in this country, and people of color, particularly African Americans, are not afforded the same opportunity to pursue happiness as the Constitution suggests we should be able to do. And my fellow deans at that time decided that they were going to have a day of reflection. And the idea was that we would reflect on race and racism and what we can do to make a difference. I decided that I would be the only dean at the school that would not have a day of reflection. And the reason that I did not have a day of reflection is that my feeling was that we are well past reflecting, and we're at the point now of action. The nation is becoming an increasingly diverse country. People that we currently refer to as racial and ethnic minorities will comprise the majority of this population of this country in just a few short decades. Around in the 1950 census, about 90% who responded to the census indicated their race to be white. By the 2020 census, that number was down to 60%. And the Census Bureau projects that that pattern will continue throughout this century. Another important pattern to keep in mind for those of us in the health sciences is that the country is also aging. And as the country becomes increasingly brown and increasingly gray, as I am rapidly becoming myself, the two populations that drive many of the healthcare costs will be growing. And the health of the population of this country will increasingly be a reflection of the health status of people that we currently refer to as racial and ethnic minorities. We spend almost 20% of the United States gross domestic product on healthcare. That is almost 1/5 of the largest economy in the history of humanity devoted to healthcare. This is an unsustainable pattern. And an analysis that I conducted some years ago, we estimated the cost of racial inequities in health to be more than $1 trillion, a major drag on the US economy. So there is certainly a compelling social justice argument for why we must address health equity and why we must create a more equitable society to do that. But beyond the social justice, there is a compelling utilitarian argument. It is expensive to maintain these inequities. Not only expensive in the human toll, but it is expensive and is an expensive drag on our economy. Throughout this pandemic, the health professions have been taxed greatly. I'm sure we all know that we all have colleagues, some of whom have left the profession, others who are burnt out, and we're going to have to redevelop the workforce in the next decade in response to this. All of these come at us at the same time. We must rebuild the workforce. We must deal with health equity because we need to be able to control costs, leaving aside the social justice part of this, which of course I am compelled by the social justice argument as well. And currently, disproportionately the consumers, especially of public health work, the consumers are disproportionately Black and brown people, but the workforce is not. This is not a pattern that I think is sustainable going forward. So what I want to talk about in my remaining time is providing a little bit of background that I think will help inform the next part of this panel discussion, which is, what do we mean by racism? We often talk about this concept of being anti-racist, and we talk about racism and its impact on health. But what I find is that when you stop and you question people about what they mean when they're talking about racism, they don't always mean the same thing that I'm talking about, because the concept is a complex concept. And what I want to do is kind of define the term a bit so that maybe this can help provide some background as we talk about how we move forward and which strategies we might take to make a difference. There are 3 levels of racism. Interpersonal racism, there is structural racism, and there is internalized racism. So interpersonal racism is the form of racism that most people talk about when we use the term racism. We're talking about bigotry. Somebody has bad attitude or bad feeling about other people because of their race, and that is what most people think of as racism. I would argue that that is the least important, the least relevant form of racism, and the least impactful. What another person thinks of me is of very little consequence unless that person has the ability to do something to enact that attitude that would have an impact on my ability to progress. Structural racism, I would argue, is still only the second most important part of form of racism. Structural racism refers to the ways that the society has been organized in such a way that it leads to racially differential outcomes. Structural racism does, even though structures do not have to have been created by people who had racist intent, although I would argue that in many cases they have been. But even if there was no racist intent, we have structures that produce racially differential outcomes regardless of anyone's attitudes, values, or beliefs. So I'll give you one example of this, is that I think is a good one to illustrate the issue. That Social Security is a program that is available to any American or any legal resident in the country who has paid into the Social Security system for at least 10 quarters. At age 67, you're able to receive Social Security. However, we have race differences in life expectancy, which means that the beneficiaries of that program are going to vary in how much benefit they will be able to get from the program, regardless of how much they paid into the system. Now, I'm not suggesting that Social Security is racist. I'm suggesting that the Social Security system produces a racially differential outcome because of the structure, because of the way that it's organized. And this is an example of how structural racism operates. It doesn't matter who is running the Social Security program. It doesn't matter who is actually mailing out the checks. The system is set up in such a way that there will be a racially disparate outcome regardless of anyone's attitudes, values, beliefs, or actions. This is the form of racism that has had a huge impact and hugely impacted the ability of African Americans to pursue happiness, as the Constitution suggests that we should be able to do. But the final form of racism, and the one that I would argue is perhaps the most damaging, is internalized racism. This is when people who are themselves the target of racism begin to adopt these negative beliefs about themselves and about their own group of people. If I can convince you that you are inferior, I don't have to create structures to hold you back. You will hold yourself back because you simply will conclude that you cannot compete. So as we go forward in this conversation, I hope that we'll think through what we mean by racism and in the context of whatever comments that we're making. And as we talk about solutions to addressing racism, that we think of those solutions within the context of the different levels of racism and the different ways that racism impact people and block their progress and their ability to develop their human capital. So I will stop there, and I look forward to having this conversation. I've been looking forward all day to this, and I'll stop there and be happy to take any questions or any dialogue that you want to have.
Thank you, Dr. Leveist. And we will have the discussants who are members of the panel respond to your comments. And just to remind everyone, please look in the agenda for the full bios, and I will just introduce each of the discussants. We have Dr. Nadeem Karambu, who's the Dean of the School of Dental Medicine at Tufts University. We have Dr. Ramona Denby Brinson, who's the Dean of the School of Social Work at the University of North Carolina at Chapel Hill. Dr. Antonia Villarreal, and I'll refer to her as Tony, who's the Dean of Nursing at the University of Penn. We have Dr. Dawn Richardson, who's Associate Dean of Social Justice at OHSU PSU School of Public Health. Dr. Catherine Lucy, who's the Vice Dean for Education, School of Medicine at the University of California, San Francisco. And also a co-moderator is Marcus Henderson, who's a member of our workshop planning committee, who will also be addressing some of the questions. So to begin with, just want to remind everyone that please use the Q&A to ask any questions, and Marcus will be monitoring that as well. So in 2 to 3 minutes, can each of you share any quick reflections on what resonated with you from the conversations with Dr. Klotman or the remarks of Dr. Leveist? And feel free to let us know what's going on at your school in DEI and anti-racism, or within the larger institution where you are. And we'll begin with Nadeem.
Good afternoon, everyone. Real pleasure to be here with all of you, and certainly to learn from you. The first two speakers really have allowed me to continue my journey in terms of understanding. And usually anytime you can write down one pearl from any kind of a workshop, you feel like you've achieved something. I have 2 pages worth of pearls already, so thanks for your presentations. So you already heard from Mary Klotman about the medical school experience. What I'm going to talk about is the fact that even though we all exist within our schools, we're all part of an academic health center. And the question for us, I think, in medicine, dentistry, nursing, and all the health professional schools is what are we doing relative to each other as we talk about interprofessional education and certainly interprofessional practice. I think that environment is really rich for us to try to explore. More importantly, I would like to expand a little bit on what was already brought up. In other words, how do we as deans work across units, but also at the university level, because it's very easy, I think, to be isolated. And what I would like to describe to you in the next 2 minutes is an example of what's going on at an institutional level, which percolates down into all of the professional schools and into the undergraduate school at Tufts University. So Tufts University has committed to becoming an anti-racist institute. And I'll quote from our president, Dr. Tony Monaco. On June 19th, 2020, we gathered to celebrate the Juneteenth holiday, explore the profound effects structural racism can have on Black colleagues and students within our community, and discuss how we can become a more equitable university tomorrow than we are today. And on that day, we virtually heard from all of our constituents from all the schools. I listened to the voices of our Black students, faculty, and staff. And just like Mary Klotman, it was the first time that I had a very profound experience in listening to those voices and really breaking down and hearing those voices. To continue his quote, we pledge to find and eradicate any structural racism at Tufts and to take the steps necessary to become what every member of our community would view as an anti-racist institute. And to that charge, I'll talk about the areas that Tufts has been working on. The charge was in 5 different areas that included compositional diversity, equity and inclusion, an institutional audit. We heard about the importance of a survey and targeted actions. And then 2 extremely important work streams to look at campus safety and policing and what that means to members of our community, and also looking at public art across our institute. The participation was broad. There were 5 work streams with 9 co-chairs and 110 committee members. The key activities were a review of 433 policies across all schools, 60+ interviews that were conducted, 52+ focus groups facilitated, 20 hours of data analysis performed, 15 peers assessed, 4 open forums, 2 visioning workshops held, 2 analysis of public art, and 1 workstream report. The output, which is critical for any action plan, were 5 reports detailing areas of strength and opportunity by workstream, 180+ recommended targeted actions, and 1 integrated roadmap representing the synthesis of these 180+ actions. The current state includes diversity, equity, and inclusion as a university priority. Schools units have independently advanced DEI efforts. For example, each one of us have hired assistant deans of diversity, equity, and inclusion. And finally, education and training, that has been an area of focus. The areas of opportunity, I'll just read these off, are drive accountability, improve processes, revise and clarify policies, provide funding and resources, and the university is committed $25 million over 5 years towards these efforts, although with fundraising, I'm sure that will increase. Expand education awareness and training, and expand measurement capability. Finally, the vision for this group is to be an anti-racist and diverse institution. Together, we will continuously advance equity, inclusion, healing, and justice for the Tufts community and beyond. I look forward to the discussions and questions. Thank you.
Thank you, Nadine. Ramona, you've only recently become the Dean of the School of Social Work at the University of North Carolina at Chapel Hill, but you've been able to initiate some major changes there. Can you talk us through how you were able to accomplish so much so quickly?
Yes, thank you so much. I'm humbled by this opportunity to be in a space with individuals so committed to this important work. And I will answer that question directly, but I just want to applaud our colleagues, Dr. Glotman and Dr. Levis. I think they have given us a charge. So much of what they said resonated with me. And I want to pick up on 2 of the themes that Dr. Glotman shared, because that's part of, where we hope to be in some of our work here at UNC. And one of the themes that I heard from her talk was this notion of elevating leadership and rewiring our culture. And then I want to conclude with accepting that charge from Dr. Levis in terms of what do we mean by racism. But I would first start by saying we're at a very introspective phase at my school in terms of the work right now. And there are 5 questions that are percolating for us. The first question we are considering right now is this question of who leads. That's why I was so intrigued by Dr. Glotman's model, where she talked about intentionally being out of this space of elevating other people. The question we're giving ourselves around who leads is we're having conversations about institutional racism requiring us to really look at those who possess political and economic power. and position those people to be in these conversations. Oftentimes when we have these conversations and these initiatives, it's the usual suspects that are leading these charges, people of color, women. And so we're asking ourselves, you know, what would disruption and transformation really look like if those who are the ones who need to correct these wrongs, reverse these systems, are the ones that are leading these conversations? So what if we were to build allies out of our regents, our chancellors, our trustees? What if they were the ones to be positioned to lead these conversations? Because we believe that corrective action is not necessarily in the hands of those who are being oppressed or those who are experiencing racism. So that's one of the first reflective questions. Who leads? Who should lead this? Related to that, number two is this notion of power, privilege, and positionality. We are reminding ourselves that we all have those three. A lot of times people of color and Black people have been led to believe they don't possess those. We do. We possess power, we possess privilege. It's how we use those. And so we're having conversations about positionality and really what racism means. And Dr. Levice asked us to define that. And I would say that the reason that this is such a tough nut to crack is because it's about power and money. And people aren't likely to give that up. They're not going to give up their money. They're not going to give up their power. And so I would add that to Dr. Levice's point. Another question that we're grappling with here, not unique to my school, but very present for us right now, is this issue of culture and climate. There's a lot of healing that needs to occur. And I think you have to start where your system is. I long for the day that our system is where Dr. Klopman's system is and Dr. Levice. I think you have to start where you are. And you can't jump a step. And so we spent a lot of time around culture and climate and actually being honest about past harms, what has been done to Black people, saying that out loud, doing some truth telling, having those conversations, not being afraid. And then the fifth question that we're in right now is actually talking about how our health and our mental health and our well-being is tied to anti-racist cultures. We are saying it out loud that racism is making us sick. Racism makes us physically ill and emotionally ill, and it's all of our responsibilities to correct that. And so part of, coming in to my deanship, and this is where I want to end with Dr. Levice's charge about what do we mean by racism. I totally agree with the three levels: interpersonal, structural, and internal. Some of the structural things that I began to address right away is noticing that we had huge disparities in pay based on gender and people's ethnicity. 7 months, we've corrected those. We've reversed those. So where there were $20,000 pay gaps that could not be explained on people's merit or productivity or time and rank, could only be explained by people's gender and ethnicity, we've reversed those. So I think action has to occur right away. We're beyond this discussion of values. People have to see concrete action. And I would add that to part of what Dr. Levice is saying in terms of the importance of those structural elements and ridding ourselves of racist practices. Thank you so much.
Thank you. Dawn, your reflections.
Oh, thank you so much. I have a lot. I'll narrow those down though. Well, at first I really wanted to thank Mary for just sharing the really exciting and strong work underway at Duke. It's very affirming and it gives me a lot of hope and energy for our work here at the OHSU PSU School of Public Health. I also want to thank Tom for just providing the framing comments that really highlight that what we're focused on here when we talk about anti-racism is really the structures and the systems that maintain and uphold white supremacy at every level of the institutions in which we all sit. And what strikes me really, I think from hearing from them is that I recognize so many of I see similarities both in the orientation to the work and the approach to the work that's underway there as what's underway here. And I know other institutions as well. So I'm guessing this is probably true for many of us. They're seeing, similarities in these different schools. So as a community organizer at heart, my thought is, how do we work together to build our power and influence to really extend beyond our institutions? So of course, I do recognize this work is not, cookie cutter, and it should certainly be based in localized grassroots efforts that really center the lived experiences of those who are most impacted, in our unique spaces. But yet I just still feel like there must be some opportunity for shared effort, shared learning that can really reduce the expenditure of the labor, that we're all putting out there. So I guess my question that I'm just sitting with as I'm hearing this and hearing others speak is, what might a collective effort across all of our institutions be able to really achieve with regard to truly dismantling structural racism and white supremacy in ways that really shift the power that you were just speaking to, Ramona, the power that sits across our different spaces, across our different fields, and isn't just about each of us in our individual schools making these fantastic changes, but bringing together schools of medicine, dentistry, social work, public health in ways that really move that power to where it ultimately needs to be, which is in the hands of those who are most impacted by structural racism. So I'll share more when we get to the panel, but those are just the top of mind thoughts.
Thank you, Dawn, for your reflections. Tony, can you share some of your reflections with us, please?
Sure. I think I feel like I'm in part of the Amen choir here. There's just a lot of similarities and joint initiatives that moved forward. So I want to share a little bit about our experiences at Penn. And again, Mary's journey was similar to ours, to many. I'm sure that the events of June 2020 certainly opened up or made even more bare wounds that have been present for a long time. As we were struck in our school, and again, watching what was going on in the country, I was struck by the number of outraged statements and commitments that were being put out by everyone. And our approach, sure, we put our statement out, but it was measured. And it was measured for a couple different reasons. Number one, and again, in reflecting and looking back at who we were as a school and where our goals were, we have a pretty strong social mission statement. It's baked into our values. Social justice is part of our treasured values, and health equity is in our mission statement. So we had a number of great things to build on. But this all, and when we're thinking about, again, what are you doing? The one thing that we had just finished doing, and as you all were talking about in your committee about thinking about accreditation, I think many of you are familiar with the social mission metrics that comes out of George Washington University. Fitzhugh Mullen and his group were in charge of that, started in medicine and then went to all the health profession schools. And the metrics that they're using are a lot of structural components that go beyond DEI, but I think really get at a lot of the structures in health professions education that are necessary for health equity. So we finished our evaluation and we came out pretty good. We were in the top percentile and we were very proud of that. But we also saw areas that we needed to grow. And despite what was, people said we did well, we took this as an opportunity to take a look at what we were doing in the school and to try and elevate and amplify our efforts. Unlike some of the other speakers that had talked about, we didn't create special groups to address this, but instead we went to the existing structures, to our personnel committee, to all the faculty committees, to all the staff committees, to the departments, et cetera. And we asked them deliberately, take a look at your processes, take a look at how you're doing business. And we want you to take a look at these structures to see what is it that we're doing that impedes an equitable environment. We asked our student groups to do that as well. And we asked them to report by a specific date about A, what that was, and B, what they were going to do about it. So again, rather than coming to the dean and saying, what are you going to do to fix it? It's like, this is a community and we're all in this together. So after gathering that, we consolidated those components, certainly looked at Again, I appreciated Tom's comment because the different types of racism, they don't live in silos either. They're all related. And I think you have to figure out what are the levers you can address, where and how. But this process really did lead to, I think, as Mary talked about, some small wins and small gains and processes that were absolutely instrumental in creating a more inclusive environment. It also was the energy that we needed to change policies that we knew we needed to change. The big one for us, for me, was changing GRE, not requiring GRE scores as entry into graduate education. Always an issue, but you know, we love our stats, and those were hard for us to let go, but this is what moved us in that direction. So, you know, again, what we have now is, again, people have their plans. We have, we elevated a couple positions to make sure people knew that, make sure that our emphasis on focus on equity was reflected in our organizational structure. We have an evaluation framework that we're all accountable for taking a look at, and we report on that on the initial, on our initial meetings and our group meetings as well. So again, those are the processes that we put. I think it's a method of continuous improvement, and we're all in.
Great, thank you. Catherine, can you share some of your reflections with us, please?
Thank you so much for inviting me. This has been a spectacular session already, and I can't say enough about the learnings I've had from everyone who's been on here today. I'm going to talk just briefly about our Differences Matters initiative at UCSF and the insights we've had as we enter phase 2 of a 5-year initiative. So we had one 5-year initiative, and now we're on our second phase with this. And I think it dovetails nicely with what Mary says. But before I say that, I just want to say, in echoing Dawn's comments, we don't have an option other than to do this together. It's our responsibility as health professions, schools, to educate the workforce that our nation needs, and that workforce needs to be diverse, culturally humble, committed to addressing healthcare disparities, and committed to working to eliminate disparities also in educational environments and opportunities. And it won't help to just do one institution by one institution. We need a national movement for this. And I really hope that the deans on this call are listening to this and thinking about the power they might have to transform healthcare in service to our diverse communities. As the second phase of our Differences Matters comes up, though, I wanted to talk just briefly about organizational change and the lessons we've learned, because I really resonate with what Mary had said in terms of the launch of an initiative like this. It is often catalyzed by activism of faculty and students in response to social issues. And in many ways, it's tragic that it takes the death, the visible death of many Black men to put this front and center in our initiatives. But now that it's there, and this happened to us in 2014 with our students responding to the deaths of Eric Garner and Michael Brown, Tamir Rice, and others at the hands of police. And what I would say is we've been on this journey. We have come very far as an organization, but we have so far to go, so far. We're not even close to the second, we're not even close to over the edge in terms of where we need to be as an organization committed to equity, diversity, inclusion, and anti-racism. And what I want to give a cautionary note about is the journey can be super rocky. And initially, there has been work in technology curves. There's a curve called the Gartner Hype Curve. There's work done by the dismantlingracism.org group, which talks about the 6 phases of racial equity work. And I want to make people aware of what comes down the road, at least 5 years down the road as we are at UCSF. When you first start one of these initiatives, people are generally unaware, and they really need their eyes open to the way that structural racism creates the environment that we're in. And Dr. Levy's comments are really foundational to what we need to convince people to understand, that structural racism, internalized racism, and interpersonal racism all are embedded in medicine, in education, and almost every other social structure that we live in. And when you get awareness, and it often comes through these hearts and minds stories, right? Statistics that you look at, and then the devastating emotional consequences to not only the people who were killed by police, but the people who witness this and fear this on a daily basis, including our students and our faculty. And people actually get really motivated by that, and they are enthusiastic about setting ambitious goals and solving this problem like you might solve any other big problem in healthcare. And the first phase of awareness really is associated with people's willingness to adopt new behaviors. Sort of along the behavioral change spectrum, they are willing to hire a vice chair for diversity in all the departments. They're willing to go to training. They learn about microaggressions and bystanders and upstanders. They may embrace IAT training or implicit associations test training for their search committees. And things do begin to change. The organization becomes much more conscious of what's happening and much more fluid in their conversations about some high level diversity, equity, and inclusion issues. And what often happens then is when you pay attention to it, things begin to work. You recruit a more diverse faculty, recruit a more diverse medical student class to enter. But there's another stage that happens in all organizational change, and some people call it the trough of disillusionment. If it's the Gartner hype term, the dismantling racism, people call it the not knowing stage. And that's the stage when the work begins to slow down and get super hard, and there's increasing conflict around this in the institution, even beyond what you saw before awareness happened. And that happens for a lot of different reasons. For people of color and Black and African American individuals, they get frustrated by the lack of speed of process and the realization that there is so much that we're up against that has to be changed, and they're not confident we can do that work and sustain that work. It also happens in non-Black, non-people of color, white and privileged individuals who are like, you know, this is hard work, and now you're going to ask me to change myself, and I'm not really sure I want to do it. And people will say, I'm afraid of doing it. I'm afraid of speaking. I'm afraid of conversations. I feel like nobody is paying attention to me. I feel like I might be subject to discrimination. You've heard it all before: fear, fragility, frustration, futility. You know, there are a series of really negative consequences. But the reason I bring it up is not to get discouraged, but to recognize this is a vital part of the change journey. And what you have to do at this point is double down. You have to go back to, why are we doing this? We're doing this not to respond to students or faculty, although they benefit, but the major beneficiaries will be our patients and our communities and the better health that they will achieve. So you have to double down. You have to remind people what we are doing. You have to actually make sure your strategies are going to get us further. And that usually requires another stage of even deeper learning, where you ask people not just to add new behaviors, but to change existing ones. And one that requires really people mastering some core concepts of structural racism, as Dr. Levy said, but also of what white supremacy culture looks like, what white privilege culture looks like. It's hard work, it's painful work. And some of the ways that people have advised doing this, which we're embarking on now, is through affinity and racial group caucusing, to help people in different groups understand their role in this change. But also to set really concrete metrics and move the institution forward, saying, in fact, we cannot decide to give up on this because it's too hard, because our patients are depending on it. Their sons and daughters are depending on it. Our communities need people to advocate for them, both inside the exam room and also to people in power and government and things like that. So I'm going to stop there. I'm saying the road is rocky. Anticipate that after an initial honeymoon period of time, things will get challenging for a while, but I think it's incumbent upon us as leaders to identify that, call it out, remind our communities this is critical work that we need to do to solve a big problem, as big as pandemics, as big as HIV. And with it, we should actually be able to fulfill our commitments that we've made to our communities and our society.
Thank you, Catherine. Thomas, do you have other reflections that you'd like to share with the group?
Yes, thank you for giving me that opportunity. We did many of the same things that my colleagues on the panel have talked about. We established a committee, we've appointed an associate dean, and we have a plan that we're working from as well. But I wanted to add one dimension that we haven't really talked about, which is really the first thing that I did in the DEI space when I came, even before we set up the committee and began developing a plan, was look at the overall institution, the overall organization. Tulane is the largest employer in the city of New Orleans, a city with a well, we're not a very affluent city, and one of the things I did was ask the chief operating officer of the university, who do we bank with? And he told me we banked with several national banks. And I suggested to him, so what if we move some of those accounts into the local Black-owned community banks here in New Orleans, banks that do business loans and mortgages here locally? We could have an even bigger impact on this community. And to his credit, it took 15 seconds for him to get it. He immediately got it and saw the point, the benefit that we could have here if we did something like that. I only asked him to move $5 million. The last time we talked, he was over $11 million in that bank, and we were bringing that bank onto the campus, and the bank is becoming more and more embedded in what we do here. Universities are places that produce knowledge and we teach people, but that is not all that we are. We are big businesses that are important parts of the economies of the communities in which we serve. And there are ways that we can have an impact well beyond the gates of our campus in terms of, we stimulate tourism in our communities. We stimulate economic activity. We have to purchase pencils. Well, if I've got to buy pencils, then is there anyone here in New Orleans that's selling pencils? And so as we begin to think that way and move away from national, vendors, looking for local vendors, how we can have an impact right here in our community. I think this is also a part of the DEI message, because if there was one thing that I could do and that would improve the health of people of color, it would be if the economic opportunities were there and people had jobs that paid a living wage and allowed them to do the things and make the choices that other people that have a job that pay a living wage do. That would be the one most important thing that we could do, I think, if there was only one thing. So there are ways that those of us in leadership in academia can move beyond just our sector and have an impact by looking beyond just the research mission, just the teaching mission, just employment.
Yeah, some big justs for sure, right? But they can certainly make a huge difference. Thank you, Thomas.
Nadeem, all of it is my point.
Yes, great. So Nadeem, you're a member of the planning committee as well. Do you have other observations that you have heard or that efforts that are underway at your university that you'd also like to share? You shared a few with us at the beginning.
I think, I hadn't really heard about the stages that institutes and people go through. Certainly as a dean of a dental school, that's something that I start to worry about in terms of all the different issues that we're dealing with, whether it's, the COVID pandemic or the individual day-to-day things that deans have to deal with. So sustainability is certainly something that is constantly on mind. And, we do have an assistant dean of diversity, equity, and inclusion. And, I think once that work begins with one individual, it can also get overwhelming because it's not only the students that you're dealing with, but also residents and faculty, and more importantly, staff. Probably our most diverse group at the dental school, because we're really running a mini hospital in terms of our clinics, is our staff. And, it's that realization that the work is only just beginning, but thinking through these stages and how to sustain and constantly kind of keep the conversations and actions going is a constant struggle in terms of what we're dealing with.
Thank you. Ramona, you shared with us the salary equity as one of the quick wins. Were there other accomplishments that you've been able to walk through quickly at the University of Chapel Hill, North Carolina at Chapel Hill, excuse me?
Yes, the salary equity one was one that we consider our big win. So many others. I mean, there's enough work to keep us going for years to come. But I wanted to just elevate what our two colleagues just shared to Dr. Lucy and Dr. Levice. I heard them say make sure we keep our gaze external too. So although we're doing a lot of this work internally in terms of how we are resetting DEI around hiring and retention and promotion, I heard them say, what's the end game? What's the true outcome? The outcome of all of this work are going to be those communities that we impact, those patients, those clients. So I just had to really lift that up again. That just resonated with me so much of what you all said. And that's how we've been galvanizing our folks here around what is our social justice mission. It's beyond just the professors and the staff here. It's that external work. But part of our strategy is not spending too much time with the naysayers. The early adopters, that's where I put my energy. I have found my people. I identified my people. I don't spend too much time with the resistors or those that are lagging behind. So getting the early adopters, and we're getting ready to build out our new strategic plan. And we have already signaled through the consulting firms that we're hiring that it's going to be a DEI driven plan. And so those are some of the things that are helping us get started.
Thank you for sharing. Tony, as the Dean of Nursing at UPenn, congratulations on your recent award of $125 million for free tuition to nurse practitioners who will work in underserved communities. My question for you is whether or how the funds might work towards eliminating racism and addressing DEI.
Sure. Thank you for that question. I'm very excited to talk about this gift from Leonard A. Lauder for establishing the Leonard Lauder Community Care Nurse Practitioner Program. He named it himself. And I'll tell you, we were in conversations about such a program pre-pandemic, and then we took a pause during the pandemic, and then again, the need just absolutely elevated. And so while I'm proud that this is to prepare nurse practitioners, it's really more than that. And I will tell you, I know Patricia Cuff will be happy to hear this, the sort of the inspiration and thinking was from another NAM committee that I was on that centered on educating health professionals around the social determinants of health. And the framework that we used, I think, again, just echoes with not just focusing on the internal, but focusing on the external. Why do we care about educating health professionals about the social determinants of health? It's because we believe as health professionals that we have a role to play in advancing health equity. We're not the total solution by any means, but we are part of the solution. And so how is it that we can structure education with community partners in a way that benefits all? And so the program that we have is very much centered on this area. So not only are nurse practitioners, our students will be afforded full tuition, but we are also investing in communities. And so our partners that we will engage in are those that have federally qualified health centers or medically underserved areas in urban and rural who are willing to engage with us in a reciprocal commitment to educating our students. And we in turn engage with the communities, not just around the education mission, but also around practice and whatever community needs are identified as well. So we hope to be bringing more than nurse practitioner students. We expect our education to be collaborative and experiential, and again, invest in these individuals for continued development. Importantly, what we hope by embedding in education in communities that we will also draw from the communities to provide access to an education, to an Ivy League education that they otherwise never would have had. So I think this embodies a lot of what we were talking about, addresses the structure about how to educate, puts the resources in the communities and individuals who we expect will have that sustained commitment, and partners both internally and externally to make that happen. So we're very excited about what this might bring and about the learnings that that we are sure will come about that. And then I think the last thing I have to say is that this is a sustained commitment. The gift is an endowment. And at the end of 5 years, we expect that we will be able to enroll up to 40 nurse practitioner students in perpetuity. That's impact.
That's great. Well, we look forward to hearing more about the success that happens with that program. Thank you. Dawn, I have a question for you. Funding work on DEI and anti-racism can really be challenging. Yet, Oregon Health and Science University School of Public Health, you've been able to successfully fundraise for activities in this area. Please share with us how you've been able to do that.
Thank you for that question. I definitely want to focus specifically on the funds that we've been raising to become an anti-racist school of public health. So I won't speak to sort of extramural funding or any of our, I think, fairly well-supported efforts around diversity, equity, and inclusion. So instead, I just want to talk about those funds which we've raised solely for the purpose of institutionalizing anti-racism in our school. The first major expenditure of those funds was actually for the creation and establishment of my role as Associate Dean for Social Justice. Our school, the OHSU PSU, Portland State University School of Public Health, is 6 years old. So I think we're a relatively new school of public health. We're also a joint school, which makes us, we have some challenges, in part just saying the name of our joint school, and is challenging for me. And fundraising has been a really critical focus given the resource constraints that we're all facing, but also being in this joint institutional structure. Fortunately, our dean, David Bangsberg, has been really, really effective in that arena, and he has developed and cultivated an active and engaged philanthropic advisory board. When the board first came together, they were very focused on student success, and almost all of the funds being raised at that time were funneled into scholarships. But in the spring of 2020, their focus shifted, and we've heard a lot of reference to that time here. I also want to add, here in Portland, Oregon, you may have heard we have been designated as the whitest city in America. And that's a really important backdrop to understand the context in which our SPH does its work. So again, starting in that spring, we had demonstrations here, just like everywhere across the US. But here in Portland, at one point, the federal government deployed law enforcement here in Portland. It really created a focal point for folks locally and regionally. And these protests then continued for more than a year with significant social and political impact. And of course, this was all dovetailing and paralleling the global COVID-19 pandemic. So I raise all this context here because frankly, it's really impossible to speak to our success in galvanizing philanthropic investments in our school without talking about those events. The focus here on the Black Lives Matter movement and the increasing clarity among non-public health people on the devastating impacts of racial inequity that stem from the oppression related to racial inequities has provided us with a huge window of opportunity. And what it's done is allowed us to much more effectively engage our philanthropic community in conversations about not just how racism and health connect, but how in order to really advance public health, we have to address the institutional, internal racism to our School of Public Health. And I think it was maybe Catherine that was talking about this. It's our trainings, our training centers themselves that are complicit in this as well. It's not just external. And I think for many of us in public health, it is often felt that the lens has been pointed outward as opposed to pointed inward. So bringing our philanthropic community on board for that understanding was actually fairly simple given the context of Portland at those times. So to answer the question of how we've been successful, I would just say by bringing our philanthropic advisory board along, helping them understand the connections between the protests in their city, the inequitable impacts of COVID on communities of color, the challenges of retaining and supporting our tremendous and outstanding faculty of color, and the thriving and success of our BIPOC students in these very white centering institutions. So once our donors were initially drawn to the school because they care about student success, and once we began to then explain to them the link to the upstream drivers that were resulting in adverse student outcomes, they became very clear that the best way to support students in the School of Public Health was to develop a large dedicated pool of unrestricted funds to help us do the work of becoming an anti-racist school. So I think the TLDR answer in that case would be building really strong relationships with our institutional foundations to ensure that they're bringing the right donors into the institution in the door, identifying those donors' passions. Many of our donors, I'm sure at all of our schools, are clearly all about student success, and then walking them upstream to really show them how they can have the most impact, sustained impact on those students by building their anti-racism capacity and their racial literacy in doing this work and being real partners to us in those efforts.
Thank you, Dawn. Catherine, you're at UCSF's School of Medicine, and there you have an ongoing commitment to anti-racism and DEI. How are you sustaining momentum for the work that you're doing, especially in light of the challenges that most institutions are facing with budget cuts due to COVID?
Yeah, somebody wise once told me that the document that shows the true values and ethics of an institution is its budget. And I think that's really true. Any strategic initiative we do at UCSF, like any medical school, has to be appropriately resourced, and those resources have to be sufficient to achieve the goals that you set out. And I think one of the challenges we've had with this work in the past has been, it's been done on the backs of faculty of color, women, LGBT faculty who are doing this out of a passion and aren't appropriately recognized, resourced, or supported. And so as the work we've done in Differences Matter since 2015 has unfolded, we've undertaken a series of different principles that guide our work and guide our budget. First is, it's our job to amplify the voices of and support career advancement and sponsorship of faculty of color and those who've come from groups that have been historically excluded in medicine. We've done this through new recruitment strategies that fund minority faculty for a third of their work for the first 3 to 4 years of their time at UCSF to get them started. We've funded all of our Differences Matters leaders with release time. And I'm very pleased to say that every Differences Matters leader who worked on phase 1 of the initiative has gone on to a subsequent leadership role within the institution because of sponsorship and really just recognition. 2, it's really important to create centralized resources so that frontline control points can do work at their unit level. When you get down to this work, it requires changing behaviors, changing ideas, changing recruitment, changing strategies at every single level of the organization. And if you stay too high, you miss the opportunity to change the cultures in our care delivery units and our classrooms and things like that, that really do have an impact on our patients, on our faculty and our students. So I think it's important to sort of make sure you're working at all levels. That's one of our learnings. Third, I would say we strive everywhere to work in parallel, not in series. It is a big mistake to focus all of your educational efforts on this generation with the hope that when they mature into independent practitioners, the world will change. We don't have time to wait for that. It takes a full decade for people to get into practice and even longer to get into organizational leadership roles. So we have to exert our educational strategies and our change strategies on students, on residents, on faculty, on leaders at every single level in all mission areas, and not wait for this to sort of wash downstream from existing people that we've recruited. That's hard work, but if we don't do it, we will be leaving a lot of time and a lot of people in our wake by saying that we can wait for another 10 years to make these changes. And then lastly, as Mary talked about, the importance, and I think Dr. Levies did as well, the importance of structural change can't be overestimated. When we did an analysis in the first phase of Differences Matters of our, for example, promotion and tenure, but more importantly, our student assessment, advancement, and honors, we found systemic evidence of bias that always favored non-Black, non-people of color students. So it was always the white students who had the higher grades and the higher level of honors. And for really no supportable reason, we tried many things to change that. And ultimately we decided to change to a pass-fail system, which created a lot of angst and a lot of concern about, will this be beneficial? And I will say, yes, it is beneficial, and no one has been harmed in that. And in fact, it's caused an ability for our students to learn on their own time. And we have seen elimination of the previously observed fourth year rates of honors and awards. And so I think people are always nervous about these changes, because one of the enduring legacy practices of medicine is this myth of meritocracy, where our focus is always exclusively on identifying the best rather than ensuring all our best, and it doesn't really matter if you turn out 5 the best students in every medical school. You want 100% of your students to be the types of people who can alleviate suffering and improve the health of our communities. And if we put more of our time and energy in terms of assuring that everyone was going to be the type of doctor we'd want for someone we cared for, and not so much about caring who's in the top of the class based on medical knowledge exams, I think we'd have a whole different workforce. So those would be the things that I would say. All of them are resourced in some part through the dean's office, but as Dr. Klotman talked about, another critical element is creating incentives and recognition for departments to also invest their resources. In schools of medicine, many of our departments are well resourced, and getting them convinced to, inspired to, recognized for, and incentivized to building their own infrastructure, I think is another way that we create sustainability in this work. But in the end, it's got to come from the top. It's got to recognize the people doing the work. And people have to understand that we don't have an option but to do this work. It's critically important for our missions.
Great. Thank you, Catherine. Thomas, I don't know if you've experienced any resistance or pushback to your work, either in DEI or anti-racism, but if you have, are there some examples that you can share with us, and maybe how you were able to address the challenges?
Well, I mean, pushback, change, humans are not wired for change, right? So any change, even innocuous change, is a non-controversial change, is going to result in pushback. And I certainly did have some pushback, but not a lot. I did have one of my board members that did resign from the board, who did not agree with the direction that I was going in. That did happen. Shortly after that, I had another board member call up and tell me that she was donating $250,000 to the Dean's General Fund because she appreciated the direction we were going in. And a second board member said that called to tell me that she had decided to endow a new professorship in my name, which I'm still stunned, but because, so there'll be some who will push back and who will not want to go in the new direction. But then you will find you find the people that are willing to take that journey with you, and you focus on those people. When I was being recruited for and interviewing for this position, I was quite clear on what I would focus on and things that I would do. And I was hired with the understanding that I was going to take the school in that direction. And, I found that overall, the university's leadership has been nothing but supportive of what I'm doing. And the pushback that I have received has not been significant enough to cause me to change course.
Great. Thank you for sharing that with us. So we have about 7 minutes left, and this is for anyone to answer. Often we talk to ourselves, but what we really need to do is reach those who are not in the room. How do we reach those who do not see DEI or institutional racism as an issue that requires attention?
Well,
any one of you can take that. Go ahead.
Well, I'll jump in.
Well,
one of the things that I've wanted to focus on and have been able to now is to work with the accrediting agency, CEF, the Organization that accredits public health, and we're working on embedding anti-racist and health equity competencies into the next version of the accreditation criteria for schools of public health. I think those are the types of structural changes that we need to make, so that it's not just those schools that happen to have leadership that decide that they want to move in this direction, but redefining what it means to be a competent public health professional. I don't think you're a competent public health professional if you don't have some understanding of health equity and you're not prepared to work in communities with diverse backgrounds. I don't think that you are a competent health professional if you don't have that background. And, and I think increasingly the accrediting bodies are beginning to come around to this. And I do think that not only public health, but the other, our sort of allied professions, I know medical schools as well as social work are looking at these issues and how we can embed that and redefining what it means to be a competent professional in the field.
Great. Thank you, Thomas. Marcus, I know you're monitoring the chat. Do you have any particular questions that are that you think we need to share with the panelists?
Not so much. Some of them mostly focused on specific targeted questions that some of our panelists have been great about eyeballing those and responding throughout the session. There is one kind of wanting to extend upon that pushback that Dr. Levis was talking about. He talked a little bit about those in leadership roles, some faculty pushback, but this particular question was interested in students. So the tensions that may or may not have grown between white students and students of color due to pushback related to anti-racism work and initiatives, and how do you or how would you address that amongst your student population?
Yeah, I actually did not have that issue. In fact, if anything, the students have felt that I'm not moving fast enough. And so, but I haven't really had much pushback, at least not that's bubbled up to me. What I've come to learn as dean is that people often don't want to bring bad news to the dean. So I'm not aware of students who have really been pushing back. And I haven't gotten any feedback from the students that I am working with that's been an issue among the student body. That might be a function of the field. I mean, the type of person that goes into public health, I think, maybe more attuned to these issues and less likely to push back.
I think
Catherine and Dawn, you have your hands up. I'm sorry.
I would say that pushback is a strong word, but there are at times concerns that are raised about how much time is being dedicated to this, whether a particular affinity group also feels that their group that has been historically excluded is getting sufficient attention. And all of these things I think are great. We look at them as great opportunities to educate and to surface issues that we might be able to address in their concerns. And I think that this generation is growing up in a much different environment than we did. They have been hearing about these things for half of their lives, unlike we have. I don't know what will happen going forward, given the recent spate of book banning issues that are being heard. But I do think you have to be alert to that, because you want to surface those issues and you want to actually have the conversations about why a system that's designed to elevate and support and address discrimination against those who have been historically the most disadvantaged will actually advantage everyone. And I think that there are ways to do that, but welcome that as appropriate concerns and have a conversation. And some people you'll be able to change their ideas and some you won't. But someone said that earlier, that sometimes you just can't spend a lot of time on the people who are the naysayers.
Right. Well, thank you for all of you sharing such rich comments and really helping us to be able to see what's been working well at your institutions, and that there have been opportunities that others will be able to learn from and glean. And now I'll turn the mic over to Tanya for closing comments.
Wow, that's my closing
Great
comment. This was an amazing session. I want to thank all of the panelists and speakers for sharing your wisdom with us today. The audience had some very thoughtful questions. I hope you get the opportunity, if you haven't, to respond directly to some of those questions. I know that we will have links that were in the chat will be included in the resources that are provided to the audience and to all participants after this session. I also want to thank our planning committee members who, so this was such a great idea. I mean, I think you guys, because I can't take credit for this, when we talk through these levers of change and having these kinds of discussions, I don't know about y'all, but this panel has completely outdone what I had, what my expectations are. I want to just point out some of our panelists some of our workshop members who were part of the panel. Dean Nadeem Karambooks, Marcus Henderson, Dr. Lemietta McNally, and Dr. Sherilyn Black. Thank you so much for doing the work that you've done. I also want to shout out to a couple of our other workshop committee members, Dr. Ryan Petaway and Dr. Hadia Green Guerrero, and of course my vice chair, Dr. Rick Baker. I just thank you all so much for your forward thinking and your vision to have this kind of opportunity. I want to let the audience know that we will have one more session. It's tentatively scheduled for March 23rd from 3 to 5, and we're looking a bit deeper about on the topic of metrics. How do we measure what it is that we are saying that we want to do as it relates to eliminating anti-racism? There were some great resources that were provided today that I think will help us move forward in that discussion. But we also want to look at funders, those external funders. What role can they also play in moving us along? Rick, do you have any closing words for us?
Wow.
We got to see you, Rick. You can't not be on the screen.
I cannot do that. Okay. Okay.
There we go.
So, yeah. So wow. No, I echo your sentiments. Two amazing sessions. The earlier one with Dr. Black and Dean Klopman, and this later one. Again, as I mentioned, I think in the chat, I think we're all closer to the truth based upon these last 2 hours. So this has been great.
Thank you all so very much. Have a great rest of your evening, and we hope to see you on March 23rd. Thank you.